Hi, this is a continuation from the previous video. If you remember the previous video, I demonstrated how you can process a patient called John Doe that walked up to the front desk, the reception, or the medical records officer to book an appointment to see a doctor. And John Doe, being an HMO patient, had to be verified and then checked in before they can proceed to see a doctor or a nurse. In this video, I'm going to log in as a nurse. The nurse we used earlier, Nurse Titi, who was scheduled, to see the patient John Doe. I'm going to log in as Nurse Titi. Again, this is a test environment. This is a test. These are all test data. Um, at mail.com. And I'll log in. Great. So now we have logged in as Titi or Nurse Titi, who happens to be the nurse that was booked to see Mr. John Doe. Nurse Titi needs to go to clinic module. Also, because that appointment was set to GOPD location, Nurse Titi has to ensure that the locations tab here is set for GOPD clinic, which is the current clinic where she's currently working. If Nurse Titi were to be in OB-GYN, she should click on OB-GYN location. I just want to show you how this appointment is important to choose a location when setting appointment. So we click on appointment, and remember in the previous video we set an appointment for John Doe, but we can't seem to find that appointment here. That is because we are in the wrong clinic location. To access the data that we seek, we need to go to the right clinic location where the appointment was scheduled for, which is GOPD. Now we are in the right location, and we can see the patient who is sitting right across from Nurse Titi. Nurse Titi would have to click on this patient. Nurse Titi has to be sure that this patient has been checked in. Again, in the case of HMO patients, Nurse Titi has to ensure that the HMO patient has been checked in, meaning the patient has passed through all verification processes to be able to access care at your facility. So now this patient is checked in. Nurse Titi is about to see the patient. This is optional. Nurse Titi might choose to set the patient status to with nurse, so that every other person that's waiting for this patient would know that this patient is currently with Nurse Titi. Now I'm going to click on attend to client. But before I do that, let me explain. Nurse Titi now needs to document all the physical proddings and examinations that she has conducted on the patient. I do know that as a nurse, you need to take the patient's vitals and document it. To do that, you click on attend to client. Yes, now we are now in the documentations page for this patient, and Nurse Titi needs to document the patient's temperature, the patient's um, pulse, and all of that. So to do that, you click on new document, click on the document you want to use. In this case, we want to document vital signs. So I'll click on that. And let's say the temperature is 36. Let's say the pulse is 62. Let me just use false, not realistic data. So because we're documenting pain, I just wanted to explain that you can say, okay, this patient complained about pain, and the pain is on a scale of 1 to 10. The patient said the pain is actually on a 6. You can also say how severe the pain is instead of using a number to describe the pain. Your choice. Also, we want to enter the patient's height and their weight in kg. I'll save as final. Click continue. Before I proceed, ensure that you save as file now. If you save as draft, it means that you're not done with this documentation. You need to continue at a later time. But if you're done collecting every data that you need to collect at this time, save as file now, and that is done. Also, let me just quickly state that there are other documentations that this nurse can do, whilst they're seeing this patient. The nurse can document nursing notes. They can quickly just create a note based on their discussion or proddings or, you know, examination of the patient. Nurses can also document medications that they have administered, but we'll do that in a later video. Also, nurses can document medications lists if it applies. You can document medications list and the patient's complaints of allergies, as whatever the case may be. For the sake of this video, we will end it here at collecting vital signs. Now we've taken the vital signs of this patient, it is time to send this patient to see the doctor, you know. So I'll go back to appointment and, the patient is gone. I need to change the status to vitals taken so that the doctor is aware that, okay, the vitals has been taken. This again is optional, but it is vital for the doctor, for the nurses to do this. Now we are done with processing the patient from the nursing area or from the nursing bay. It is time to document this patient's encounter from the doctor's point of view. See you in the next video.